Well, let's get started. So hello and welcome to today's open event, where we'll be providing you with an overview of our exciting health professions education and medical education MSc programs. Thanks very much for joining us. My name is Kate Thomas and I'm the events officer for the Faculty of Medical Sciences here at UCL and your chair this afternoon. We're hoping this session will provide you with an insight into what it is really like to study health professions education and medical education here at UCL. So this afternoon, our speakers, Catherine and Amanda, will provide a summary of our exciting postgraduate programs, followed by a Q&A session, so there will be plenty of interactive opportunities for you all to join in throughout today's session. This session is being recorded and will be made available on our website following today's event. We're here to respond to your questions, so please share those throughout using the Q&A function on Zoom. Before I introduce our speakers, I would like to update you all by letting you know that the application deadline has been extended to the 30th of June 2022. Now to introduce our speakers, we have Catherine O'Keefe. Catherine is a professor of medical education at UCL, where she leads the MSc in Health Professions Education and undertakes research in this field. She has a background in nursing with extensive experience of leading medical and health professions education, including previous leadership roles within HEE as an Associate Director of Education for a large NHS trust, and earlier in her career as a Director of International Education for a charity specialising in HIV/AIDS care. Catherine has a particular interest in the application of educational theory to leadership development within healthcare settings. And Amanda Sara. Dr. Amanda Sara is a senior educationalist at the Royal College of Physicians. Amanda is an education specialist, fellow of the Royal Society of Arts, and author of the Literacy Toolkit. Amanda has worked in numerous senior leadership roles within education, and more recently has been involved with both national and international assessments. Amanda is passionate about medical education and has significant interest in digital learning. Amanda is currently the co-lead of the MSc in medical education and leads the RCP's Emerging Women Leaders Programme. Thank you so much both. Before I hand over to our speakers, we would like to run a few polls for you to answer. So I'll just launch those before we hand over. So hopefully you should see the poll questions that have popped up on your screen. If you haven't, please do just put something in the chat if you can't see anything, but hopefully you have. So the first question we are interested in finding out is, where are you currently based? So are you currently based overseas or in the UK? Another question that we're curious about is, what's your health profession? So please indicate, obviously, the option that is most relevant to you. Equally, you can select the other option if you'd prefer to do that. And we've got another question, where are you in your clinical career? So if you would like to indicate one of the options, so we've got early career health professional, mid-career health professional, foundation, speciality, consultant, and other. Which program are you interested in? So if you are interested in the MSc Health Professions Education or the MSc Medical Education, please feel free to indicate on the poll. And would you prefer online or face-to-face teaching? This is just really interesting for us to know in terms of our teaching delivery. What educational role do you have? Again, so if you could indicate whether you're a medical educator, a health professions educator, lecturer, health medical educator, or other. And again, if you can just let us know what educational role you would like to have in the future as well, that would be fantastic. So again, those are the same options. So it'd be really interesting to hear your experiences on those. Okay, fantastic. I can see I had a few responses, but I'll give you a few moments, so no rush. I know there's quite a few options to read over, so you've got plenty of time to answer. Okay, fantastic. I think we've had answers from everyone, so that's great. I'm just going to end that and then share the results. So hopefully you should all now see the results on your screen. So really fascinating. So we have about 25% of you are overseas and 75% are in the UK currently. So what's your health profession? You see that 25% are doctors, 25% dentists. So we've got a really good mixture actually, and we've got pharmacists, 25%, and other 25%. If you've chosen the other option and you'd like to share with us, please do just pop that in the chat as well. We'd love to obviously hear what's your health profession background. Where are you in your clinical career? So we've got early career health professionals, that's 33%, mid-career health professionals, 33%, other 33%. Again, if you would like to indicate in the chat for the other option, please do. That would be really fascinating for us to know. And we've got 50-50 split for the interest in the course, so that's great. So hopefully we'll be able to answer all of your questions today. And would you prefer online or face-to-face teaching? So everyone has indicated online. Okay, that's quite interesting. What educational role do you have? So we've got a mixture, so medical educational educator, clinically based at 25%, and then the rest have indicated other. Okay, that's interesting to know. And then again, a mixture of what you would like to go into in terms of an educational role. So we've got medical education, medical educator, health professions educator, lecturer, and health medical educator. Okay, so hopefully we've got an option for all, we've got someone for each of the options. That's fantastic. Okay, hopefully that will give us plenty of food for thought for the Q&A segment as well. Fantastic. Thank you so much, everyone, for submitting all of those answers. We really appreciate it, and hopefully that will help us as well in terms of making sure that we can provide you with the best outcome of today's event. So without further ado, I will hand over to Catherine. Thank you, Catherine.
Lovely. Thank you very much indeed, Kate, and a warm welcome to all of you that have joined so far. Really interesting from the poll. I can see we've got a nice diverse group, which is super. So no doubt we'll have some interesting discussion after I presented and Amanda has presented. As Kate said, I lead the MSc in Health Professions Education. It's a sister programme to the MSc in Medical Education that Amanda is going to talk about, but we do cross-fertilise as well and collaborate across the two programmes. So what I want to focus on really is the particular characteristics of the MSc in Health Professions Education. Firstly, it's designed to be very flexible. If you've watched the video on the website, you'll see the people that were interviewed there, the students and ex-students all talked about its flexibility. It's a modular programme, so you can take one module at a time over a 5-year period. So you can actually fit it in ideally around a busy clinical working life and other life commitments. The module is the MSc is fully online. And again, that's to facilitate the flexible access. So we have London-based students, but also students from across the country and international students. Although if you're thinking of joining us internationally, we do work on UK time or Greenwich Mean Time for planning of sessions. but it's a very flexible programme. Within that flexibility, there's the option to exit with a PG cert, or move on to a diploma, or exit with the full master's programme. We've also designed it so there's several different pathways that you can follow. You can choose whichever modules you want and include a dissertation or report to follow the generic pathway if you want to complete for the masters. But equally, we've got some more specialist options. We have an option for leadership, which is increasingly popular, where we look at clinical leadership, but also specifically at how we can be leaders as educators as well. There's a primary care pathway that looks particularly at issues and challenges faced within primary care, and a research pathway for those of you who would like to specialise in research. We now have an approved pathway for assessments, and this will be live hopefully shortly, but we're currently developing that at the moment. The other thing to say about the programme is that it's interprofessional. We have doctors, nurses, physios, pharmacists, audiologists, healthcare scientists, a whole range of different people. So it's quite an interesting programme from that perspective. And just one thing I must say as well about the online offer, we try and make it highly interactive. So it's not just asynchronous sessions or online learning activities, it's Zoom meetings like this, where there's lots of interaction and a chance to get to meet your peers and tutors. And finally, just to say that a comment on where this programme can lead you. Well, I think the world's your educational oyster when you complete this programme. As there are the various pathways I've mentioned, so you can focus on clinical education, you can work in higher education, or you can move into policy organisations, which many of our graduates have done. So I think that gives you a flavour of our programme, and I look forward to hearing more questions about it. But I'll now hand over to my colleague Amanda to tell you about the programme that she's co-lead for.
Thank you, Catherine. A warm welcome to you all. Lovely to see you all virtually. So I lead the MSc in Medical Education, which has been designed by RCP and UCL to meet the requirements of doctors who are intending to have a significant role in medical education, and is delivered by experienced teachers, senior clinical medical educators and consultants. So the MSc in Medical Education not only allows for progression in the field of medical education, but students also receive tailored one-to-one support, networking opportunities, and the access to the Medical Education Resource Centre, which is based at the RCP in London. So undertaking an MSc in Medical Education allows you to benefit from the outstanding reputation of both UCL and RCP. Our days tend to be face-to-face teaching days, which are based at RCP London. You'll receive tailored support from one-to-one tutorials, and you'll get the opportunity to network with a variety of like-minded professionals. You have the opportunity to undertake a flexible mode of study, and you can exit at either certificate, diploma or master's with any of those qualifications. So the structure of the programme, the first year of the RCP UCL MSc in Medical Education is a flexible modular 60 credit course, typically completed within 1 year. And this course consists of 14 attendance days of at least about 350 hours of self-directed learning. On satisfactory completion of year 1, students can choose to exit with a postgraduate certificate in medical education or continue to year 2, which will be the postgraduate diploma in medical education. And again, completion of year 2 gives students the opportunity to either exit with at the diploma level with that certificate, with that qualification, will go on to the master's. So the diploma actually consists of 13 attendance days and at least 350 hours of self-directed learning. And the modules within the diploma are research methods in medical education, advanced teaching skills, which are the compulsory components, and then optional being advanced clinical education and course and curriculum design. So completion of the 4 diploma modules, including passing all 4 assignments, is required before progression onto the master's module. For the master's module, students will be supported to undertake an original individual piece of research, which you may wish to be considered for publication. The research can be qualitative or quantitative or mixed methods. And at present, there's an opportunity to undertake a literature review style report. That is an option which we're offering at the moment. Examples of previous MSc dissertations can be read within our library, and students who wish to complete the MSc will have a full 5-year time limit from commencement of the course to fulfill the requirements. So again, that should give you a bit of a flavour for our course. Thank you, everyone.
Thanks so much, Catherine and Amanda, for going over a summary of both programmes. That's really helpful. I can see we actually have, I'm not sure if this was an intention or not, but we have a raised hand. So I'm going to allow Muthu to join us if you would like to ask us a question. Equally, if you would prefer to pop your questions in the chat, we can do that as well. Fantastic. Okay, I can see we have one question in the Q&A. So we're looking, the course which I have interest in is Anaesthesia and Perioperative Science, which is available only for part-time studies. However, it's not possible to get visa for a part-time course. What should I do? I think for this course, we'd have to look into the other programme. I think that's correct, isn't it, Catherine and Amanda, for yes, anaesthesia and perioperative?
It's not, that's not the courses that we're talking about, so it will be more appropriate if it's possible to find out the programme leads who will be able to help them.
Yeah, so yeah. Irvi, what I will do once I think because we'll have other questions coming in, but I can send you the details of the programme leads for anaesthesia and perioperative science. So you'll be able to contact them directly. So that's not a problem. I'll do that. Okay. And I think we have another comment in the chat from Nashra, which is so what are the main differences between both of the MScs? So I don't know, Catherine, do you want to take that one?
Well, I think that's a really good question. I think from our presentations, you'll see they've got slightly different structures and focuses. Ours is completely online. I know that, and Amanda, you allowed onto this, that you have offered some online because of COVID, but the focus is face-to-face. Ours is also interprofessional. It's open to all health professionals, but the Masters in medical education is just for doctors. But Amanda, you'll have noticed other differences as well.
I think the main one really is the difference between the delivery with regards to the UCL course being is online, is virtual, and only because of the COVID in the last 2 years have we reverted some of our days to online. But our intention is to go back to the previous format pre-COVID, which is to have the face-to-face.
But also I'm right in saying that your course is only doctors are eligible to apply your course. Yeah, and that's because it's based within the Royal College of Physicians, so it's particularly suited for that, I think. But yes, so they cover similar ground, but have slightly different designs and slightly different emphasis within them. Yeah. So I hope that answers your question.
Fantastic, thank you both. Just having a look through the chat to see if anyone has any more specific questions, or do feel free to pop them in the Q&A. I do have some questions actually that were submitted in advance to the event, so we can go to those, and then equally if any other questions crop up, we can answer those as they come in. So the first question was asking, what does a successful applicant look like to you? So I don't know which course this was relevant for, but it would be really great to have both of your perspectives on an answer to that question. So Catherine, over to you.
Well, I'll let Amanda go first this time for parity.
So we have the entry requirements on the website. So for the master's programme, it's exclusively for qualified doctors, and we welcome applicants from all grades and specialities. Applicants should have a role in medical education, and as such, we would recommend applicants have completed initial training programme within educational research. It's a very popular programme, and due to competition for places at all levels of the programme, it's important that the application form includes details of the applicant's role, responsibilities, and your interest for medical education. There is an English language requirements, so you'll be expected to demonstrate evidence of adequate level of English proficiency. But do have a look online, because we have a testimonial page and some student blogs about their experience of the programme, which is really interesting and fascinating to read.
Yeah, so we have a similar approach with the applications for the Masters in Health Professions Education. It is, as I've said, they're open to all qualified health professionals of whatever discipline. We also require a 2-1 undergraduate degree or equivalent experience, just to make sure that you have that academic background that will be needed to study at master's level. I think the other thing to say is that while you might not have a specific education role at the moment, what we really need to see in your application is your interest in health professions education, and the sense that you actually understand what the course is offering and how you're going to take it forward, how it's going to help your career, or how you're going to apply it in your practice. So there's lots of information there on the website. So looking at that, and then when you're thinking about your application, what it is about the modules that we're offering that you think might help you in your current practice, or in your future career. If you want to really get into it, health professions education, you've not got much experience, what is it about those modules that's going to help you? I think that's really important, because the application that you submit and your testimonial there is crucial. You might tick all the boxes for the qualifications, but if we get a sense that you don't really have a good understanding of the programme and how you're going to be able to use it to help yourself develop, then we would either ask you more questions, or we might actually think, no, this programme isn't for you, because we want to make sure it's that you're a good fit to the programme so that you can get the most out of it. Amanda, you wanted to add to that?
Yes, and I'd just like to reiterate the point that Catherine's made. It's so important to demonstrate a passion for medical education within your application form. So if you feel that there's some criteria that is is perhaps not to where you want it, but you can demonstrate your passion for medical education, and that can come across in your application. That will be particularly helpful.
Fantastic. And then we have another question, which is actually a really lovely question. So this is, I think, aimed at both of you, and asking what inspired you to go into your current careers.
Oh, wow.
So, Amanda, would you like to start that one?
What a lovely question. Thank you so much. So I have a real love for research. I've done a lot of research over the years, and I've always had an interest within medical education. And so I felt very fortunate when an opportunity came up at the Royal College of Physicians, and obviously very excited to work so closely with Catherine and UCL on this course. So yeah, it's a real passion for the subject, which I feel is so important.
Thank you. Yes, I think I share that same passion as Amanda for this area, but I think my route into education was slightly different. As I was, it basically stemmed from the time when I was working internationally in HIV and AIDS care, and I realised that to be able to reach the number of people that needed care and to be able to promote sustainable change, that I was going to have to get involved in educating and training health professionals to adapt and the new generations. So that led me on a very interesting career path, planned happenstance, I think they call it, when I started getting involved in doing master's programs and then a doctorate. And then when I decided not to travel, I found, well, this is the area I'm interested in. So I got involved in working with Health Education England in London and other trusts, and then UCL. So I think if you're really interested in helping people develop, interested in improving patient care, and interested in research as well and how to do that, these sorts of programs can help you see all the different opportunities that you can have by studying education in relation to medical and health professions education. It opens so many other doors to your career. And the other thing I think I'd say, it can really sustain you, because clinical work is incredibly challenging, but having that interest in education helps you to stand back, look at yourself, look at others, and look at how to improve and support people in many different ways. So it's even though it's really tough studying while you're working clinically, or coping with other commitments, I think it will stand you in incredibly good stead for the future.
Thanks so much, Amanda and Catherine. Well, I feel very inspired by both of
You're
your
welcome
responses.
to join us, Kate.
Yeah, I might. I'll take you up on the offer. So I've just had a look through the Q&A, and hopefully I've answered the question about the programme, but let me know if there's anything else anyone would like me to add in. Don't know if we have any other questions in the chat. Let's just double check. No, again, feel free if you prefer to talk to us as well, we can allow you to join us as well on the video call if that's just easier than typing. Please do feel free to raise your hand and I can have you join us. Okay.
Yes, it can be a bit intimidating doing that, but if you, as Kate said, do feel free to, yes, trust her to join and to speak if that's easier.
Okay, I think we've got a question from Linda. Thanks, Linda. So your question is, any additional requirements? So are there any additional requirements needed for international students? So I'm not sure which course that was for, but equally, I think Amanda and Catherine can probably both contribute to the answer for that one.
For me, I think Amanda mentioned the English language requirement, and Lisa on the call, correct me if I'm wrong, I don't think we stipulate the level. There are various exams that one can take, but again, what I would say is that the statement that you write is usually very evident of your ability to speak and communicate or to write in English, which is particularly important. So that would be crucial, I would think. But otherwise, because, well, for the Master in Health Professions Education, it's online, so you don't need a visa, so you can study wherever you are in the world. But I presume, Amanda, for yours, would students need a visa if they're international students?
Lisa, can you help me?
I'll come in here. So because the program is a flexible modular program, visas aren't permitted for the MSc medical education program. So international students cannot get visas to actually attend the MSc ME program. And with regards to English language, it's the same level for both programs, and that is good. It's a requirement for it to be good.
Thank you.
Thanks so much, Lisa, for jumping in there. I can see that we have another question from Nashra. What career pathway can a dentist take after the completion of the course? Could you please elaborate? So I think don't know if Amanda, would you like to go first?
Yeah, of course. So I think after completing the course, you can get heavily involved with medical education. I think Catherine touched on this earlier. You know, you might want to go into teaching or lecturing, or juggling that alongside your present career. You might also want to get more involved with writing articles as well, or presenting. We do have quite a few of our alumni come back and present some sessions, and we do have some of them come back and actually teach and tutor on our sessions as well.
Yes, I think I would completely second that. I think the other thing to say is that dental education actually aligns very nicely with postgraduate medical education and undergraduate education. So there are some quite distinct career pathways beginning to emerge, say particularly with health education, and now it's merging with NHS but the pathways around more sort of managerial approaches to working in education, managing the foundation dental training programs, for example, or working as you progress to become a dean in dental education. So there are those sorts of options as well. And there's a big emphasis on primary care dental education. So there will be options there to get involved either in that managerial stance or directly in supervising students at undergrad or postgrad trainees. So there are lots of different options as well. It's probably with some of the other professions, it's sometimes more difficult to see those roles, but I would certainly encourage you to speak to people in the dental school, but also people at Health Education England, once it re-emerges from the merger it's undergoing at the moment. They will be able to give you some specific suggestions on the roles that are beginning to emerge, but there's lots of exciting opportunities as well.
Hopefully that answers Nashra's question, but thank you so much both for answering that one. Just having another look through the chat. Again, feel free if you have any specific questions for, thank you, Nashra. I'm glad we were able to answer that one for you. If you have any specific questions about your background, similar to what Nashra was asking, do feel free to obviously ask away. We're here to answer any questions you have for both programs. I think I don't know if we had a hand raised earlier, but again, if you'd like to jump on the call, feel free to unmute as well. Oh, okay, yep, I can see. Okay, fab. I don't know if having a look at any of the questions, if anyone has any more in terms of other questions that we received prior to the event. I'll just go down my list again. And so another question, it was slightly similar to the successful applicant question, and it was particularly asking about the personal statement. So what are you looking for in the ideal personal statement? So I don't know if you can narrow that one down. Obviously that's quite a big question, but equally, Catherine, do you have any advice?
Well, I think if it's well written, that really helps. A good standard of English, it's coherent and makes sense, and conveys a genuine interest in the subject area. Sharing what experience you may have of health professions education, which may at the moment feel very limited, but it can be small scale peer learning or seeing the need for it in your practice, but making it clear why you feel this is an important area to you, and again what you are what you think the particular program is going to offer you. What is it about the modules that you're interested in, maybe which pathway you might like to follow, and then some sense about how you think you might want to develop your career using the masters afterwards. And you may not be clear as yet, but some sense of that will really help, so that when we read the statements, we want to make sure that you've got a good understanding of the programme, why that you're applying for it, and also a well-written statement is really important, because we think if you can write a good statement, then you're actually going to be in a good position to cope with the course. For those of you who don't necessarily meet the criteria, for example, if you've got a 2-2 rather than a 2-1, in your undergraduate degree, the statement can really help, because if we think, wow, this person looks really strong, we can either ask for more information, or we can have an interview with you to see if we might be able to get a suspension of regulations to get you in the programme. So that sort of thing is really important, putting a lot into it, because with master's programmes such as these, there's an awful lot of writing. So demonstrating that you're able to express yourself well in your statement really helps. Amanda, anything you want to add on that?
No, I agree. I think it's so important that it's really clear, that you talk about your experience, you demonstrate your passion in your writing for medical education, and you show an idea of where you're thinking this could take you. But do allow yourself time to write that statement. And to go back and reflect upon it, because that statement is so important for us to get an understanding of why you'd be a really good fit for the programme. So do take time on it. Thank you.
Thanks, Amanda. Thanks, Catherine. So we haven't had any other questions come in, but hopefully that means that we've answered everyone's questions that they had possibly beforehand. Just looking back at the audience poll results, I thought it might be interesting for us to just take a look again. And obviously I can see that a large majority of you are particularly interested in a mixture of going into all types of roles following. So I don't know if anyone wanted to elaborate, if you're feeling brave, if anyone wanted to elaborate on the educational role that you're hoping to get into. And equally, we're here with the experts today, so they can obviously help advise you in terms of if you're particularly interested, as I know the options are, if you're interested in getting into a more into a lecturer role or anything, whether it's higher education based. We've got the experts in the room today, so I can see that there was one of you that was particularly keen. So feel free to ask away about what you indicated in that poll. But perhaps we could actually get Catherine and Amanda to share a bit about how to go into those roles. So I think we've got some indications of medical educator. So in terms of attending the course, how would someone particularly go into those roles following completion of the course? So we could start with the most popular, shall we? Which is 50% is health professions educator, clinically based.
Yes, well, should I dive in first, Amanda?
Yes, please.
Yeah, I think I would actually see it as a progression from where you are now through the programme, and then when you exit the programme, because you'll be involved in some sort of health professions education now. If you're working clinically, you'll be showing people around, you'll be supporting more colleagues who've recently joined, which all involves education. So I think as on the course, you'll probably see more, it'll help you see where you're involved in education, but also how you can more actively get involved. You'll develop skills and how to teach, understanding the broader context of particularly workplace-based learning, how you can work with colleagues to improve the learning environment. And I think as you're doing that, beginning to apply the theories that we share with you, your colleagues will notice that opportunities will open up. But all of the work that you will do on the master's programme is about applying theory to practice. So we'll be encouraging you to think about what you're doing, even get involved in doing some small scale projects so that you can actually begin to develop skills. But telling your colleagues what you're doing, they'll immediately think, oh great, and Natasha's going to be able to help us with these new students that are coming in, or be able to support and mentor a new colleague. So you then start to flag your interest and your experience, you gain more experience, and you can start to talk to people where you're based about, well, who leads education here? Go and have a chat with them, say you're interested, and that will then lead to more opportunities. So I think in my experience, it's very much a snowballing effect, that you're interested, you're asking questions, you're showing that you're developing skills, and there'll be a lot of interest then in you from colleagues. Great, we've got someone else who's interested in education. So I'm sure many doors will open. But Amanda, do you want to add to that?
Yeah, I absolutely agree with what you said, Catherine. I think it's about the networking opportunities which become available for you when you're on those programs, and they're so readily available as well. So it's about seizing the opportunities and, you know, just chatting to people and saying, this is what I'm hoping to get involved in. Is there an opportunity? And there are opportunities out there. So please do articulate what you'd like to get involved with.
Yeah, and I think just having that network connection between the Royal College of Physicians and UCL, so you are going to be open to a whole pool of networking opportunities with researchers and that are at the very top of their field. So it's a really exciting environment to be in and to study on, I can imagine. Okay, I don't know if we had any closing remarks or words of advice before. Obviously the deadline has been extended to June, so equally, if anyone has any questions beyond today, we have now got a bit more time, which is fantastic, to for you to, if you're interested in the courses, to reach out to us. Amanda and Catherine are both very happy for you to contact them if you have any questions about the courses beyond today's event. And yeah, I just wanted to take this opportunity to say thank you. And if you would like to give us a bit of feedback following today's event, we have a very short survey, just a few questions. So if you can let us know how you found today. And yeah, thank you again to Amanda and Catherine. And we all hope that you have a lovely evening. And if you have any questions whilst you're making your application or beyond, feel free to contact us. Thank you very much, everyone.
Thank you. Nice to meet you all.
Nice to meet you all.
Take care. Bye.
Thank you. Bye.
Thank you. Bye.